Good day, my name is Rectum and this video covers the assessment of male genitalia. First is to gather all the needed materials for this assessment, which is the gloves. The next is I will introduce myself and verify my patient's identity. So, good morning sir, I am Rika Guevara, your student nurse for today. For verification, may I know what is your name and when is your birthday? The next is to explain the procedure to my patient. So for today, sir, is I will be assessing your genitalia to check if there are any abnormalities or underlying conditions, and I want you to be relaxed and stay calm during the procedure. Is that okay with you, sir? The next is to collect the subjective data. Assuming that I have collected the subjective data, I will be washing my hands and also provide privacy for my client. Then, to instruct my patient to wear a laboratory gown and also position him in a supine position to access all the needed parts for this assessment. First is to inspect the base of the penis and also the pubic hair for growth pattern and excoriation if there are any erythema or infestations. So as I inspect, the pubic hair is coarser than the scalp hair and also there are no presence of excoriation, erythema, or any infestations. The next is to inspect the skin of the shaft for rashes, lesions, or lumps. So as I inspect, the skin of the penis is wrinkled and also hairless. There are no presence of rashes, lesions, or lumps. Next is to palpate the shaft for hardened area or area of tenderness. So as I palpate, I notice that it is non-tender, it is soft, and flaky. The next is to inspect the foreskin for its color, location, and integrity for uncircumcised patient. So as I inspect, since my patient is circumcised, I notice that his foreskin is intact and it is uniform in color with the penis. The next is to inspect the glands for its size, shape, lesions, or redness. I observe that the gland's size and shape varies and it appears to be rounded, broad, and also even pointed. The surface of the gland is smooth and free from ulcers or lesions. Next is to palpate for urethral discharge by gently squeezing the glands using my index and thumb finger. So as I palpate, I do not see any discharge. After the penis, we will now proceed on the scrotum. First is to inspect the size, shape, and also the position of the scrotum by instructing our patient to hold out the penis out of the way. I observed that the scrotum varies in size and shape according to the temperature. The scrotal sac hangs below or at the level of the penis, and the left scrotal sacs hang lower than the right scrotum. Then next is to palpate the scrotal contents, which is the testis and also the epididymis, using the thumb and my first two fingers. Next is to inspect for the skin color, integrity, and the presence of lesions or rashes. Okay, so I observed that the scrotal skin is thin and crinkled with little hair dispersion. Its color is slightly darker than the penis and there are no presence of any lesions or rashes. Next is to palpate the spermatic cord and vas deferens, noting for nodules, swelling, or tenderness. So as I am palpating, the spermatic cord and vas deferens is filled uniform on both sides and also the cord is thin, rope-like, and smooth. After the scrotum, we will proceed on the inguinal area. First is to inspect for the femoral and inguinal hernia as we instruct our patient to turn their head and also cough. Okay. So as I can see, as my client turned their head and cough, I don't see any presence of bulging. After the inspection, we will now proceed on the palpation of the inguinal nodes and inguinal area. So as I palpate, I do not feel any bulging or masses. Then next is we will proceed on the anus and the rectum, and we will position our patient into a Sims position. First is to inspect the perianal area and also the surrounding of the anus for any swelling, ulcer, redness, or any thickening of the epithelium. And as I observed, there are no presence of any abnormalities. Then next is to inspect the sacrococcygeal area for the redness, dimpling, and also swelling. So as I can see, it is smooth and free of redness or hair. Then next is to palpate the anus, and we will inform our patient that we will be going to insert our index finger. So as I insert my index finger, I felt that the sphincter relaxes and permits the entry. The next is to palpate the rectum, noting the tenderness, irregularities, nodules, and hardness. And I felt that the mucosa is smooth, soft, non-tender, and there are no nodules present. Then next is to palpate the peritoneal cavity and note for the tenderness or nodules. Then the last one is to palpate the prostate. And I can tell that it is, or I can felt that it is non-tender and rubbery. So this is the last part of the assessment. We will now be putting our patient into a comfortable position, and we will be cleaning and sanitizing the materials that we used, and also perform hand hygiene and sanitize ourselves. Then next is to document all the findings that we have gathered and also report it to the attending physician of our patient. So this is the end of the assessment of the male genitalia. Thank you for watching.